Alright, good afternoon, guys, and welcome to today's presentation. So today we are going to discuss about management of a patient with severe burns using the nursing care plan. So note that in most cases when burns are brought in the exams, they are brought, the management is usually a prophenema format. Now this year in March, burns came and they brought a nursing care plan. And because it was a nursing care plan, a lot of students didn't attempt it because they didn't know how to go about it. Because we are used with a prophenema when it comes to burns. And also note that burns can come in pediatrics or surgery. So it's a very, very important topic. Yeah, so let's get to our discussion today. So remember to share, like, and subscribe to this channel. Okay, so let's look at our objectives for this discussion. So at the end of this presentation, the nursing student should be able to acquire knowledge on how to nurse a patient with severe burns using a nursing care plan. So this is our objective. So when it comes to burns, depending on how severe burns are, it is an emergency. So you take it as an emergency. So first you have to resuscitate and do the first thing first in order to prevent complications, acute complications such as severe dehydration and hypovolemic shock and the respiratory distress. So now let's look at our aims. So the aims of management for a patient with burns as follows. 1, we want to prevent shock. 2, we want to improve tissue perfusion, especially for burns affecting the chest or the trunk. 3rd, to relieve pain because patients with burns usually have a lot they are in a lot of pain because of the exposure of the nerve endings. Then we also want to lay anxiety because the patients are usually anxious because of fear of death or lack of exposure to burns or because of how severe the burns are. So we want to provide effective psychological care to promote the mental status of the patient. So that is one of our aims. Then the other aim is to want to ensure that these wounds heal accordingly and quickly and prevent wound infections. So these are our aims for the nursing management of a patient with burns. So now when it comes to the nursing care plan, you have to write a table. I'm sure by now we know how to come up with the table. So it has to have it has to be drawn like this. So we have one column here for the date, then for time, then for the problem which we have identified, then we have the nursing diagnosis, so why you are coming up with that problem, and then we have the objective or the aim of the aim, then we have the nursing interventions, then we have the rationale, the reason why you are intervening, then we also have the outcome or the evaluation. So as you know, in that the nursing care plan is a plan on how you're going to manage this patient. So always put that in mind. So one of the problems that a patient with burns will have is the fluid volume deficit. So fluid volume deficit is the identified problem, and the nursing diagnosis is that the patient will have fluid volume deficit related to the massive shift of fluids out of the blood vessels and insensible losses through evaporation evidenced by tachycardia and hypotension. So when the skin is burnt, the body cells and tissues are exposed. So not only are the cells exposed, the blood vessels are also destroyed. So when the blood vessels are destroyed, the blood which was in that blood vessels will be forced to shift out of the blood vessels into the interstitial spaces, or even just coming out of the destroyed skin or tissue. As a result, a patient will lose a lot of fluids and electrolytes. So this is the nursing diagnosis. Then our objective is that we want to correct or to prevent hypovolemic shock and to replace the lost body fluids and the electrolytes. So that is our aim. So in the initial phase, we want to make sure that we do this. And how are we going to do it? The interventions as follows. One, we want to insert a cannula. So an IV access is going to be established. So a cannula will be inserted. And why are we going to insert a cannula? For administration of IV fluids. So notice that when you write an intervention, you're supposed to write a rationale. So when you just write the intervention without the rationale, you won't have the 2 marks. You may only be given 1. Now, if you write your intervention with your rationale, you are able to get 2 marks. So first, we are going to establish an IV access, and that is by inserting a cannula for administration of fluids. Then we are going to use, using a Parkland's formula, we are going to administer the prescribed fluids such as normal saline, Linger's lactate, or 5% dextrose. So why are we doing this? We are going to administer the fluids to replace the lost body fluids and electrolytes. So we are administering the fluids because this patient has lost a lot of body fluids and electrolytes. So we are administering the fluids in order to replace those lost fluids and electrolytes. So thirdly, we are going to insert a urinary catheter. So we are going to catheterize this patient. Why are we catheterizing this patient? Because we want to monitor strict input and output monitoring. So we want to monitor the input, how much fluids we are giving the patient, and how much urine is coming out. So another thing that we are going to do is we are going to record the fluid input and urine output on the fluid balance chart. So we are going to make sure that we open a fluid balance chart. When we just commence the fluids, we also open a fluid balance chart where we are going to record the amount of fluids that the patient is receiving, the time when the fluids were commenced, and the duration, how long the fluids supposed to run. And why are we doing this? Is because we want to monitor and prevent fluid overload. So we want to monitor how much fluid you are giving to the patient so that we prevent fluid overload. Then also we are going to observe the patient for any puffiness around the eyes. So we are going to observe the patient for any puffiness around the eyes. So when this is evident, it will show that the patient has received a lot of fluid and they have fluid overload. So as we are administering the fluids, we want to look out for signs of fluid overload, such as puffy eyes. So, and our outcome or our evaluation is that at the end of these interventions, the patient has received the correct amount of fluid, evidenced by patient having a normal pulse and a normal blood pressure. Remember that when the patient is in hypovolemic shock or they've lost a lot of fluids, they are going to have tachycardia, which is a high pulse. They are going to have hypotension. So when we intervene by administering of fluids, we are expecting that the patient should have now a normal pulse and normal blood pressure. So let's move on to the next problem. So the next problem is that this patient will be in pain. So pain can be written as pain or altered comfort. So this pain, the nursing diagnosis is that pain related to the exposure of nerve endings or unprotected nerve endings evidenced by patient crying or verbalizing. So the patient will be crying a lot of times. Patient will be crying. If they are babies, if they are children, they'll be crying a lot. And if they are adults or if they are older children, they'll be able to verbalize that they are in pain. So our aim or objective is that we want to control pain. So we want the patient to be relieved from pain within 30 minutes. So when the patient has just arrived, uh, maybe in an outpatient department, um, we want to make sure that in they are crying or they are saying I'm in pain. So we want to make sure that we relieve them from that pain that they are experiencing. So what will be our interventions? So our interventions are as follows. One, we want to assess the severity of pain using the scale of 1 to 10. So we want to know how severe is the pain that the patient is having so that we intervene accordingly. And the rationale is that so that the appropriate measures are taken according to the level of pain. For example, if the patient says the pain is maybe about 8% or 10 over 10, it means that they are in severe pain and we have to give analgesics which are strong, such as morphine or pethidine. So that is the reason why we assess the level of pain so that we intervene accordingly. Secondly, we want to administer the prescribed analgesics such as morphine, pethidine, or paracetamol depending on the level of pain. So we are going to do this so that we relieve the patient from pain. So the third point is that we are going to monitor the patient response to these analgesics. So there are moments where you give baby morphine or pethidine expecting that the patient will be relieved from pain and the patient will continue crying or complaining that they are still in pain. So we want to observe the response to these painkillers so that if the patient is still in pain after administering those painkillers, we will consider increasing the dose. Yeah, so that is why we monitor the response to the painkillers which have been prescribed. So in here we've written the rationale as to determine additional painkillers or not. So we are assessing the response of a patient. We are assessing the response of the patient to these painkillers so that we determine if we need to add a dose or not. So the third point is that because we are managing pain, so this is under pain management, so we are going to handle the patient gently and with care during nursing procedures. So because these patients are in pain, maybe wants to make their bed, maybe we want to clean the wounds, or maybe we are turning them, we want to make sure that we handle them gently and with care as we are doing our nursing procedures. And why are we doing that? We want to avoid causing more pain to the patient. So we need to be careful and gentle. So the other point is that we have to use the bed cradle to lift off the linen of the burns. So when the patient is on the bed, we are going to use a bed cradle to lift off the weight of the linen from the burns. And why are we doing that? To avoid the weight of the linen on the burns, which can cause more pain. So we want to avoid that. So the other point is that we want to provide diversion or therapy such as television viewing or television watching. And why are we doing so? To divert the patient's mind from thinking about the pain he or she is going through. He or she is going through. Yeah, so just take note of that. The point is that we want to divert the patient's mind from thinking about the pain or their condition. And so after these interventions, we want to evaluate the patient, or the outcome is that the patient has experienced relief from pain evidenced by him not crying, or patient will be able to verbalize to say, I feel much better, the pain has stopped, or the pain has reduced. So this is about pain management. So let's move on to the next problem. So the next problem is the high risk of developing wound infection. So that's our identified third problem, high risk of developing wound infection. So the nursing diagnosis is that a high risk of developing wound infection due to the break in the skin barrier, exposing the body tissues to microorganisms. So what we're simply talking is that when the skin is burnt, part of it comes out. The cells and the tissues inside, they are exposed. They are exposed in the way that there's nothing covering them. They are exposed to any microorganism can go there and cause infection. So that is why these patients are going to be at high risk of developing wound infection. So our objective is that we want to prevent wound infection and nosocomial infection throughout hospitalization. So we want to make sure that this patient does not develop wound infection, and also because they are hospitalized, we want to make sure that they do not get nosocomial infections. So that's our goal or objective. So what are our interventions? So our interventions as follows. One, we should be washing our hands before and after attending to the patient. So we should be able to wash our hands before and after attending to the patient. Why are we doing so? Because we want to prevent cross infections. So the next intervention is that the patient will be isolated. The patient will be isolated. They'll be in a separate room on their own. This is to prevent patient from getting other infections because of low immunity. So because patients with burns have got low immunity, we don't want them to get other infections. That is why we are going to nurse them in an isolated room. Then thirdly, we are going to use aseptic techniques such as wearing masks, gown, and sterile gloves during wound care. So we want to make sure that as we are cleaning these wounds, we are putting on sterile gloves, we are putting on gowns and masks. And why are we doing so? Because we want to prevent wound contamination. Because when we are using instruments or gloves which are not sterile, they may be contaminated with microorganisms which can cause wound infection. And so we want to prevent that. So we are going to use sterile things. So the fourth point is that we are going to carry out wound care daily. So the patient's wounds are going to be cleaned every day. This is to minimize the growth of microorganisms. Then the fifth intervention is that we want to keep the wound covered daily with tropical agent. So the wound we are going to be covered daily. We don't want to leave it open because it's already exposed to microorganisms. So it will be covered with a tropical agent. This is done to prevent bacterial invasion on the wound, which can result in wound infection, and that is what we don't want. Then we want to examine the wound daily. So as we are cleaning the wound, we are also examining it. We want to see if the wound is healing. Is it healing or not? Is there pus which can show that the wound has become infected? So we examine the wound daily, and this will be done during wound care, and this is so that we note any signs of infection such as pus. So the other point is that we have to discourage the patient from touching the wound. So the patient should be told not to touch the wound. This is to avoid contaminating the wound. So because the patient may have dirty hands, and if they touch on the wound, the dirty or the microorganisms on their hands can go on the wound. And our outcome is that the patient should be free from wound infection evidenced by patient not showing any sign of infection such as fever or pus. So that is our outcome on wound infection. So let's move on to our fourth problem, which is anxiety. So anxiety, when it comes to the nursing diagnosis, it will be anxiety related to fear of death and deformities evidenced by patient looking worried and asking a lot of questions. So when a patient is worried, you are able to even see their facial expressions, and they may be asking a lot of questions. So what will happen now? What will happen next? So our aim will be that we want to allay anxiety and to offer psychological support to the patient throughout hospitalization. So our interventions are as follows. One, we are going to explain the condition to the patient and his family members in simple terms. So first, we are going to explain the condition of the patient. So we can explain why the patient have got these burns, which they may know, but we need to explain the physiology, what is happening to the body because of the burns that they're having, and we have to do this in simple terms so that we promote understanding. Then the other point is that we are going to explain every procedure before doing it and educate the patient on the ongoing treatment and future plans such as skin grafting. So we want to explain every procedure before doing it. So before we clean the wounds, we have to explain to the patient that we have come to clean your wound. And the reason why we are cleaning this wound is that we want to minimize the growth of microorganisms on the wound, or we want to completely prevent the the contamination of the wound, which can cause wound infection. So we have to make sure that we explain these procedures to the patients, also for future plans in case there is a need for skin grafting. So it means that we have to explain to the patient that they may undergo skin grafting. So we are doing this to promote understanding and cooperation, because when the patients and the relatives, if they don't understand what we are doing, it may be difficult for them to cooperate. So also, the other point is that we want to allow the patient to express his feelings, how they are feeling about what they are going through, their fears. Yes, so we have to allow them to ask as many questions as possible so that we answer them in simple terms and they are able to understand. And this is so that we maintain a sense of hope and positivity. Because when a person has got burns, especially maybe facial burns, they can leave a deformity. So a patient may be worried, they may have a lot of questions. Now our part is that we need to explain what is going on in and help them to focus on a positive aspect of them so that they do not go into depression. So we have to be there for them, to listen to them when they talk, to answer their question in simple terms so that they understand. By doing that, we are going to also to promote their mental health. So other interventions include that we need to help the patient to focus on the positive aspect of self. So in case there is some need of deformity, maybe skin drafting or those severe limb bends where the patient may need amputation, we need to help the patient to focus on the positive aspect of life to prevent prevention and promote good mental health. So also, we want to involve family members such as parents if their children wants to involve their parents in the patient care, and also the significant others, maybe their husbands, if they are married, their husbands, their friends. We want to involve them in the patient care to avoid social isolation. And our evaluation will be that at the end of our intervention, the patient has been relieved from anxiety evidenced by patient being calm and no longer asking a lot of questions. And this uh, is what we want to aim for. The patient should feel good about themselves despite the things that they are going through, despite their burns. So the other problem is respiratory distress. Respiratory distress. So how will respiratory distress come about? So respiratory distress related to burns of the chest and hypovolemic shock, which may be evidenced by a low oxygen saturation and difficulties in breathing. So when it comes to the burns of the chest or the trunk, we know that's where the respiratory system is. The chest has got respiratory muscles, and so when the chest is burned, it is a bit difficult for a patient to breathe in fully and out because of pain, the pain that they are going through, and even because of the deformity structures. Maybe if there's severe bends, some of the muscles have been even bent up. So it means the patient may have difficulties in breathing. Also, if the patient has gone into shock because they have lost a lot of body fluids and blood, they have a low blood pressure, it will be difficult for them to breathe properly, and that will be evidenced by a low oxygen saturation levels. So, and also difficulties in breathing, we are able to see that maybe the patient has got labored in breathing, or maybe you can even notice other signs of hypoxia such as cyanosis. We are able to see that. So our aim or objective will be to promote tissue perfusion and to maintain a normal oxygen saturation throughout hospitalization. So we want to make sure that the patient has received enough oxygen in order to meet the body requirements. So under interventions, the interventions as follows. One, we want to make sure that we monitor the vital signs hourly in the acute phase, noting the respirations. So we are going to be monitoring the vital signs every hour and also noticing respirations at this particular time because of the condition of the patient. Also, not neglecting other vitals, other parameters such as blood pressure and temperature, which can be deviated from normal because of what is going on if the patient is in shock. So we are going to do that hourly, and the rationale is that we want to detect any deviation from the normal. Then the second point is that we are going to monitor the oxygen saturation, SpO2, using a pulse oximeter. And why are we doing this? Because we want to monitor the oxygen levels. And so when we notice that the patient is having low oxygen levels, especially below 93%, we are going to administer humidified oxygen at 2 to 3 liters per minute, or according to how the doctor has prescribed oxygen. So we are going to administer humidified oxygen via the nasal plunge or by a mask. And why are we doing this? We want to promote tissue perfusion. So this is why we are administering oxygen. Then also positioning the patient, we will place the patient in a false position and encourage the patient to be taking in deep breaths. So we want to make sure that we help the patient to be taking deep breaths to help with full lung expansion. Full lung expansion. This will also help to prevent complications such as contractures of the chest if the patient is not taking in deep breaths, or if they have fear of breathing in deeply because of the pain that they are going through. And then also under respiratory distress, we are going to make sure that we suction any circulation from the nose and from the mouth. And why are we doing that? Is because we want to promote a patent and a clear airway. We don't want anything to block the respiratory system, the flow of air in and out of the body, to prevent acidosis and the blockage of air entry. So we want to make sure that we remove suction out any circulation, or we can even wipe them out, also wiping them out so that they do not block the airway. Also, we want to encourage chest physiotherapy. Chest physiotherapy is going to be encouraged, and this is because we want to dislodge any circulations from the respiratory system. And at the end of our interventions, we want to make sure that the patient has maintained a normal tissue perfusion. Patient has normal tissue perfusion. Patient's normal tissue perfusion has been maintained, evidenced by patient's SpO2 of 400% with no labored breathing. So at the end of it all, we want to make sure that the patient has maintained a normal oxygen saturation and perfusion. And this is evident by patient having SpO2 of 100%, 98%, and they are not even having labored breathing. So these are the 5 problems that I identified for patients with burns. So you can do well to write some other problems that the patient may have, and also interventions and rationales accordingly. So I'm wishing you the very best in your exams, and may Jehovah God help you to remember each and everything that you've studied and you practiced, both in class and in your clinical areas. May God wish you bless you. May you pass your exams with flying colors. Remember to share and subscribe to this channel. Thank you.